Welcome to our presentation today on a very exciting program. We would like to share with you what we feel is a very fitting program at a harm reduction conference, and that is around prevention programs. And as we think about it, then prevention in many ways is actually the ultimate harm reduction. And so we're excited to share with you about this wonderful program that really goes upstream and is very helpful and also very evidence-based in working with youth with trying to prevent substance abuse problems. This program, PreVenture, as we say here, it is a proactive approach to support students develop self-awareness and skills in order to build resilience. And we'd look very much forward to sharing this. My name is David Smith. I'm a child and adolescent psychiatrist in Vernon. I'm also medical director for child and youth psychiatry for Interior Health and the chair of the substance use working group for the community of practice through Doctors of BC and Shared Care. And look forward again to sharing this information with Dr. Broker today.
Hi, I'm Dr. Hayley Broker. I'm a family doctor. I'm working in the North Shore right now, North Vancouver, including West Vancouver and area. I work for Foundry, North Shore, and I also have worked at Mountainside Alternative School for more than 25 years. I'm just going to touch on the BC Adolescent Health Survey. A lot of this information often comes from the McCreary survey, which some of you might have children or students at school that have done this. As you can see, the self-reported mental health conditions for both anxiety and depression have dramatically increased between 2013 and 2018. And this, the reason for using substances as well, have, been similar, but increased as well to manage stress or because they felt sad or down. So people who start using substances, youth and children even, who start using alcohol and other substances are using it to treat themselves, which is something like PreVenture is a program where we can identify these youth and hopefully give them the skills to be able to avoid this in the future. A lot of youth do avoid accessing mental health and substance use services. And when you look at this list, you may not actually think this would happen with youth. Maybe you think this would be more as an adult. So the number one, as you can see, is they don't want their parents to know, and they thought it would just go away as far as the panic attacks, the anxiety, the depression, or even if they can't actually put a name on it. That's and don't know where to go, 44%. That's and afraid of what the healthcare provider might tell them. So these are very, very interesting things and things that you should be aware of when you're looking at screening youth. Make sure that you ask questions. You can't get an answer unless you ask the question. So asking about mental health, anxiety and depression, asking about thoughts of self-harm, asking about substance use at a very early age, even 11, 12 years old, instead of delaying it till later when they're already using the substances or already have a more severe mental health issue. One thing that most people have heard about is the opioid crisis. It was really identified in 2016 as a very terrible emerging crisis. We're now getting 170 deaths a month in British Columbia, which is really more than COVID and very scary. As you can see here, this is a little bit of an old report, but 22.9% of Canadians aged 15 and older were reported to use non-medical prescription drug use. Often the first drug that a youth tries just for fun experimentation, being pushed by their friends, is an opiate like Tylenol number 3, or even Xanax, a benzo from their parents' cupboard, their grandparents' cupboard, a cupboard that they find somewhere that has these pills in them. Unfortunately, most of the people who use this have no problem with it, but the occasional youth who already has anxiety or depression finds that these pills are helping them. So they keep taking them. And then the problem is when they run out of the pills, they have to find them somewhere else. And often, unfortunately, it's on the street. It ends up being fentanyl or carfentanil, and it ends up being an overdose.
In looking at prevention and the importance of intervening early, then we know that substance use before the brain has fully developed is a significant risk for future, not only substance misuse, but also for substance use disorders. There's a lot of research to show now that essentially the limbic system matures or begins to engage much more significantly in the adolescent development during the early teens, but the frontal cortex doesn't really significantly develop or mature until late teens, early 20s. So this creates for, in many ways, significant risk and concerns about young people and their vulnerability to substance misuse. Research shows that the transition from casual use to regular use of alcohol, cannabis, other substances often occurs within about 3 years. And we have seen over and over studies show that the longer youth delays initiating substance use, generally the better the prognosis. PreVenture program is program that we first started to become interested in the North Okanagan about 5 years ago now. This was part of the Shared Care Child and Youth and Mental Health Substance Use Collaborative process. As a local action team here in the North Okanagan, then we were looking at what programs are particularly evidence-based, effective, and reasonable to implement within the school district. And at that time, then I spoke with Dr. Marvin Crank, who is a psychologist at UBCO and has worked with the Canadian Centre for Substance Use and with various other programs. He has an expertise in school-based and general substance use prevention programs, and he particularly identified PreVenture as a program of interest, a program that met the criteria that we were looking for, and really stood out amongst prevention programs. This is a program developed by Dr. Patricia Conrad at University of Montreal. And it's very interesting because it very much, as mentioned, goes upstream. It helps us to identify personality factors or traits that often are associated with initiation of substance use and later development of substance use disorders. And program is very much strength-based. It's interesting. They help youth identify some of those risk factors that then are in turn identified in a strength way to help the youth look towards their future and what their interests and goals might be and how they can help to build on their strengths and their particular personality style to achieve those goals, but also building resilience and skills to help them in being able to navigate their life and navigate potential challenges related to various types of concerning coping strategies. So it's based on cognitive behavioral interventions as well as motivational interviewing. Again, aims to support the youth in their awareness of these various coping strategies and ways to help them achieve their goals in the future.
Just going to give you an example of a person that we would see at Foundry or that anyone might see in their family practice, their school, or their counseling area. This is Danie, a 15-year-old who drinks 2 to 3 beers on weekends when they can get it. They drink more when they can get it as well. Danie has also experimented with pot, both smoking and edibles, and poppers, and that's a mix of pot and tobacco. The thing with Danie, as Danie has had some anxiety, has noticed that her anxiety improves when they're drinking alcohol or smoking cannabis. So that's something that is a concern that we talked about before. Even though I was talking about finding pills, the most common thing that youth use is alcohol and cannabis and nicotine throughout most of their teenage years. PreVenture can identify the anxiety sensitivity in this youth and give them tools for self-help and teach them how to access professional support prior to actually using the substances to treat themselves.
PreVenture program helps to screen for and identify 4 particular personality traits. And these are specifically impulse control, sensation seeking, anxiety, sensitivity, and depressive thinking or cognitive patterns. So after the youth it takes the screening questionnaire, which is about 25 questions, then they're divided into one of those 4 groups if they are noted to be amongst those who are in one of those groups categories. First group is the impulse control. This one is these youth who we know often it's associated with ADHD or impulsivity in general. Often that difficulty with being able to harness or resist impulses. These youth often are quick and impulsive in their decisions and often can be easily also led by other groups into particularly risky situations. Number 2 is sensation seeking. This group again tends to have a high need for or seeking sensation activities. They're easily bored and are often looking for different ways of achieving some type of new stimulation, tendency towards sensory pleasure and excitement. And again, these youth often are looking for ways to get that type of experience or sensation for themselves. Number 3 is anxiety sensitivity. This is, as mentioned, kind of that fear, that heightened level of anxiety. And these youth, of course, are at much higher risk of, once they try a substance, perhaps getting that sense of relief or decreased anxiety, which then is a reinforcing factor for them becoming habitual users of significant substances. Number 4 is the depressive thinking or cognitive mindset. Sometimes depression also, as we know in youth, can present as irritability rather than just sadness. And when we see this as predominant mood. Also sometimes associated with it is very significant low self-esteem, or not uncommonly is perfectionism that goes along with this as well. We see that these youth often then will again try to use these substances as ways to help self-medicate or alleviate their low mood states. Program structure, essentially initially, the youth are, we obtain consent for this. This can be either passive or active consent in many areas, and what often is permitted and seems to work quite well is sending out a letter letting parents know that we will be doing a screening and maybe inviting their youth to attend a group, and that they can notify us if they have concerns regarding this. Generally haven't had a lot opting out, but that, we leave that option, of course, available. Screening is then done through the SERPs, which takes 5 or 10 minutes and is about 25 questions. And again, easily helps to identify youth who are at least one standard deviation above in one of those 4 areas that was mentioned. By doing so, approximately 10% of youth will fall into each of those 4 categories. So about 40% of youth in a school will generally screen positive. Those who are eligible, again, as either by computer or by review of the answers, are then determined which group they might be assigned to. Then the counselors or those who are the facilitators will make individual and private invitations to those youth to attend those workshops. Often it's voiced in some sort of way of, this is a workshop to learn more about yourself and your personality and how you cope. Would you be interested in attending? So it's, again, usually very much presented in a strength-based way. The presentations themselves include 2 90-minute workshops that are done at least 90 minutes, about 1 week apart. And as mentioned, those are based on CBT and motivational interviewing strategies. The workshop themselves, as mentioned, are about 90 minutes each. The youth usually have about 4 to 8 adolescents per workshop and have 1 facilitator and 1 co-facilitator who may either be in person or may be virtual, as we're trying to implement as well in the program these days. The sessions, the youth generally are quite interested and very actively involved in those. I myself have gone through the training with that and find it a very interesting process. We start off with, again, asking the youth what sort of goals they might have for 10 years from now and types of careers, activities, relationships, etc. they'd like to be in, and then talk about how we can help to build on their strengths and resiliency and being able to achieve those goals down the road. The youth themselves are then, again, work on various strategies in being able to cope with all different types of potential at-risk coping behaviors, and substance use is only one amongst a number that is listed and identified there. So it really doesn't become the key focus necessarily, but it's more around just building resiliency and coping strategies. PreVenture program, what has been seen is that it has many different benefits. It's very much evidence-based. It's actually now gone through 8 different randomized controlled trials around the world, including in Canada, United Kingdom, Australia, and Netherlands. It is probably one of the best, if not the best, research program out there. It has been published in all of the best journals, including American Journal of Child and Adolescent Psychiatry and American Journal of Psychiatry, etc. It's very much an upstream program, as we, again, teach those skills before the problems develop, ideally. It's very specific and helps to support youth in their particular personality style and in their coping strategies. Generally very well received, and you'll see some of the comments here in slide upcoming. Relatively low cost and resource investment, being just 2 sessions, 2 9-minute sessions, then compared to most other prevention programs out there, it's significantly less sessions and less resources to achieve a very significant positive outcome. The yield, generally the studies have shown about a 40 to 50% decrease in substance use across substances, including alcohol use and binge drinking, cigarettes, cannabis, cocaine, and there's studies looking at opiates as well this time. In addition to that, because it's also helping in other coping strategies, there's also about a 25% decrease in mental health symptoms, both internalizing and externalizing symptoms such as depression and anxiety, as well as school avoidance, shoplifting, etc. So in essence, we like to think of it as inoculating the youth and helping to really prevent many significant problems down the road. One of the very interesting findings with this program is that in addition to the 40% of youth that screen positive and are invited to one of the programs in those same schools, then there's also about a 30% reduction in substance use amongst the peers in the schools where PreVenture has been implemented. We've seen the same thing here in the Okanagan. We've done the studies again and following up with our youth in our communities, and we've seen about the same, about 40 to 50% reduction in substances use in the schools where it was implemented. We've seen again about the 30% reduction amongst the peers as well. I think this stands to reason, given if you have the higher risk youth who become, who are usually somewhat of the leaders in substance use, who then are using significantly less. It's not surprising that their peers also would be using significantly less as well. Again, some of the randomized controlled trials here. So we see some of the Canadian, UK, Dutch trials, Australia trials there. These all have had at least 12 to 24 months of follow-up time. The Australian study actually has 3 years of follow-up time. And one of the most interesting aspects of these programs is that they found that over time, the difference between the intervention schools and non-intervention schools not only persists, but it actually becomes a wider and wider gap over time. So the skills that are learned seem to be persisting and continue to grow and show benefits over the years after youth participate in the program, which is quite significant. As we know in studies, sometimes there can be relapses or washout of the effect, but in this program, it seems to be actually continuing to grow with time. Here's some of the testimonials from students. These are ones taken from the North Okanagan here, and students, these were actually received from youth about 3 years after they participated in the program. So you'll see they're in grade 10 or 11. The program is usually implemented in grade 8. So even that long after the program, the youth who were approached about their experience in the program all expressed very positive experiences. None felt in any way negative struggles or experiences with participating in the program. You see grade 11 male there. I used drugs because I didn't think that the future was important. Now I have a plan to go to college and to get a job in the trades. Grade 10 female, I have a lot less panic attacks now. Grade 10 female, I learned to think about my choices and focus on what is important now. Grade 10 male there, I like to try new things, and sometimes that got me into trouble. Like alcohol, I learned how to plan for my choices. So you can see other comments there, but it's wonderful to see again that the youth generally found these as very positive and again noted very persisting benefits from the program even several years later.
So we're talking about how you can actually implement and roll out this PreVenture program, because it may sound a bit overwhelming, but it actually isn't. The potential individuals involved are your school district representatives, of course, your principals, teachers, school counselors, the Foundry virtual clinicians who have already done the training, which is so awesome, which means they can actually teach your school counselors and teachers, and Foundry Central is also providing peer support workers to help you. So this is going to be much easier than it would have been in the past. Also, the health authority has regional knowledge as well, and the PreVenture program coordinator will be able to provide support to the schools and your program implementation. So buy-in from the school district. I know that Dr. Smith would have had to start this in Vernon, but as soon as a school sees success, it is amazing how many more districts will ask for this program. In North Vancouver, one of our principals had no problem at all getting this program started. It has the most evidence, it is the least expensive, and the least amount of time that you have to put in. So it's a no-brainer as far as that's concerned. You have to get buy-in from your school staff. Again, it doesn't have to be 2 90-minute sessions. It could be split up into 3 or 4 shorter sessions if necessary. So it's very flexible, and to include it into the curriculum. Also, they can now do it by online, by Zoom, or by another type of media, which makes it a lot easier during COVID. As far as funding goes, you're going to see a little bit more of that later on how to access funding and get help funding this. The PreVenture facilitator training can be done by the representatives that are already trained by Foundry Central. So this is a lot easier. You used to have to travel to Montreal. You no longer have to do this. An introduction to the community, the letter that is sent to the parents will be sent by the teachers or principal, and they can also schedule a meeting to discuss it if they need to. The SERPS, which is the Substance Use Risk Profile and Scale, is sent out, and you're invited to have the students to participate in the actual program. This sounds like a lot, but it isn't that much to get going, and you're going to get help doing it. It's not like you have to do it all on your own. We also are getting feedback from the students and the teachers and the participants and the counselors, and that those feedback questionnaires are provided as well. So timeline, we're actually starting our pilot, although this program has been running for years in the Okanagan. We're starting our pilot in North Vancouver School District from June to September of this year, 2021. And then successful results, which we are predicting will lead to the next phase, which is partnerships with other school districts, hopefully in January 2022, and then an agreement and to support partners to lead a rollout with other selected school districts. So hopefully at some point in time, everybody will have a chance to do this.
Okay, and just in response to that, Hayley, in the interior health here now, we've received support from our board and from our leadership in interior health. We have gone from the initial program here in the North Okanagan 4 or 5 years ago to where we now have a goal to roll it out to all 16 school districts within interior health. We're currently at or engaging 7 out of 16 school districts and are continuing to move forward. So as you said, once certain school districts hear about it, then often there's almost a contagion, or certainly a piqued interest amongst other school districts to want to participate as well. As far as the training for it, then those who actually facilitate the groups, the facilitator and co-facilitator, there's a specific training process for them to go through that we'll talk about here in another slide. Essentially, there's different levels of training. There's the certified low fidelity PreVenture facilitator, which is the basic, and that's over 2 days. In order to do the 2 days, they have to already have a background of either being a counselor or have counseling background, because it skips one of the days teaching more about basic CBT skills. There's the high fidelity PreVenture facilitator, which involves also being receiving feedback and observation as they implement the program. And then there's the certified PreVenture trainer. Those are the trainer experts who receive a significantly higher level of training to help roll it out to other areas. What we're excited about this time is that Foundry is working on training some high-level trainers that then virtually they'll be able to do training of facilitators in other school districts throughout BC, and that will significantly ease the process for training and continuing to keep current facilitators in different school districts in various areas. Facilitator training schedule is mentioned. It can either be 2 days or 3 days. 2 days if they have a background in counseling, 3 days otherwise, where day 2 they work on some basic review of CBT and motivational principles. That day is skipped if they have that background as mentioned. The other 2 days is 1 day just about theoretical approach and evidence base for the program, and another day where they actually learn how to present the program and do role play, etc. Then there's 2 days where they can actually receive the supervised practice of implementing a group, and that's done in order to receive that higher level fidelity training. Cost for implementation. Talk a little bit about that. I'm not going to go into all the details here, but you can go over that at your own leisure and when you have time. Essentially, there's the cost for the booklets. That is one of the primary costs. Those are about a 20-page or so colored booklet for the youth to go through, and helps them in their own process of understanding more about these coping skills and helping them with developing that resilience. Aside from the booklets, which would be an annual cost for the students who are involved, again, usually implemented at about grade 8. Then there's also costs associated with this specific training, and that would be, of course, one time initially to train up facilitators in a school district, and then we find each year there always is some turnover, so often ongoing training as well that goes with that. Aside from that, there's also the cost of the time for the facilitators, who usually are school counselors, or may be through other programs as well, and their time in our own school district, for example, we did a matching where the health authority paid for the booklets for the students, and the schools paid the time for the teachers to participate in the program. The costs would essentially be initially would be more to start up, and then each year there's also some ongoing costs with licensing and ongoing training and booklets, which would be less than the initial years, as mentioned. What we found in our area is probably about $5,000 to $7,000 to do a startup for a school district, and that part we can see is you'll see that there are some funds that may be available to help with that cost. Again, some of the costs for the support and supervision of the trainees, and quality assurance materials, which are at no cost, and those are available through the PreVenture website out of University of Montreal.
Talking about the Foundry model, what we're doing through Foundry Central, which is, you don't have to have a Foundry in your own area, by the way, to use this. This is through Foundry Central. They are going to provide the virtual facilitator to support your co-facilitation in partnership with your schools and districts. So just as I talked about before, they will be able to teach the teacher or teach your counselor. And they're going to be supporting the program. Most of this I've gone over before. They will offer a direct connection to this wraparound support at the local centers when you have one, and at Foundry Virtual, which is an online platform that anyone in British Columbia can access.
Okay, funding sources. So one of the exciting things is that through the Ministry of Education and Ministry of Mental Health and Addictions, then there has been funding made available to the school districts to help with prevention programs and mental health literacy. This is been a 3-year project from 2019 to 2021. And each school district has been given approximately $50,000 to spend on these types of programs through the Mental Health in Schools grant program. The specific targets are around mental health literacy, social emotional learning, and trauma-informed practice. We've been assured by various school districts that the prevention program certainly would be deemed to fit within those criteria. Some individuals have questions about Indigenous and cultural safety content in the program. This program has been indigenized in certain communities in Ontario and Nova Scotia, etc. We've certainly used it with our First Nations youth in the interior health. There haven't been significant concerns, but certainly happy to work with all areas that have interests and would like to know more about that process.
So frequently asked questions are going to be next. We're just going to let you read through these and the answers. They basically cover student concerns, consent, parental notification, and how are you going to do this during COVID-19 and online? So you can read through all of these questions yourself. Thank you so much for listening to us and having a look through these slides. And I hope that you will consider the PreVenture program for your community in the future.
Thank you. It's been great being part of your conference, and we would welcome questions or interest in the program.